So let's say we have a patient who's coming into your clinic and everything they say, it's making you say, okay, heart is definitely involved here. So they say, hi, Dr. So-and-so. I've been having insomnia. I've been having night sweats. My mind, my heart, they just don't feel like they're resting. So basically they're saying that something is up with their heart organ. Now, they also tell you that they have a stiff neck, that they have shoulder pain, that they can't move their neck really well. And lo and behold, on the board exam, it might say something like they have an issue along their small intestine channel. Or they may say that they might put a landmark, like above their crease of their shoulder. So here's where the divergent channel can come into play, because a divergent channel treatment would perfectly treat this issue, because you have a heart and small intestine issue going on, which is this interior-exterior pair, and they have some form of imbalance between the two. So we have this heart with the anxiety or the restlessness, and then the insomnia, the night sweating, and then we have these issues going on along with the small intestine channel. So we know that this is the case for the divergent channels in that way. So now the next question then is, how do we choose points for this? So this is Manya's question. So in the easiest way is we have to know point location. And basically we would always start with the source, which in this case, the root of the problem is the yin side of things, which is the heart. That's the patient's main complaint. And so we have to dig into our knowledge of point location in terms of where is the divergent channel? Where is the divergent channel of the heart? Where does it separate? And we know that already with divergent channels, they will branch off at a major joint. And so for the heart, this divergent channel actually branches off right at the axilla, which is under the shoulder. And so how do you know where the divergent channel areas are? So in my schooling, we use the Deadman textbook, which it shows you where each divergent channel separates, and the zangfu of where it enters and where it rejoins. So for the heart, it says that the divergent channel, it separates from the primary channel at the axilla, and it reconnects with the heart, and then it reconnects with the small intestine at the inner canthus. So we would want to choose a point close at where this branches off, which is literally in the axilla. So what points do we have from the heart in the axilla? We have heart, so we can use heart 1 to open the divergent channel. And this gives us access to all the divergent channel benefits. Intestine,